Hello everybody, it's Victor with Cardiac Wire, and today I'm joined by Dr. Rogers, Chief Medical Officer at Heartflow, to talk a little bit about what's going on here at SCCT 25 and what they have coming up. With that, why don't you introduce yourself a little bit, Dr. Rogers?
Sure, thank you, Victor. I'm Campbell Rogers. I'm the Chief Medical Officer at Heartflow. I'm a cardiologist, spent many years in practice as an interventional cardiologist, and now have the privilege of being the Chief Medical Officer at Heartflow.
Wonderful. Why don't you go ahead and tell us what's going on with Heartflow this year and what you have going on?
So at Heartflow this year, we're at the Society of Cardiac CT meetings. We have a lot going on here. Most importantly for us is we have data looking at the impact of one of our newest products, our plaque analysis, on patient care and patient outcomes and how physicians care for patients with coronary disease. And it's very exciting for us to be able to share these data as part of a new clinical trial called the DECIDE Registry.
Wonderful. Before we jump into the data, why don't we give our viewers a little bit of a rundown of how the Heartflow plaque analysis software works?
So the Heartflow plaque analysis works as follows. Patients undergo coronary CT angiography. Those images are then sent to Heartflow. And at Heartflow, we provide AI-enabled interpretation of the images that provides information on blood flow, but now also on the content and amount of coronary plaque, the actual disease, which is coronary artery disease. We're able to measure it and characterize it in a very specific way, really that has not been possible previously.
So tell me a little bit more then about how this software and plaque analysis played into the DECIDE registry and the data you received from that.
So with any of these new AI tools, our approach has been, and is true here, that an incredibly important question is, what will physicians do with this information? And this is information that physicians want to understand, but also that patients want to understand, and by the way, that insurance companies and people who pay for healthcare want to understand. So the DECIDE registry asked the following: if we give this new plaque analysis information to physicians, in and of itself, how does it change how they care for patients?
And how does it change the way they care for patients? What's the information they can take away from it?
So what we found was that when this information was provided to physicians, even after they'd seen the CT angiogram, it changed medical care in over half of patients. So physicians' decisions were changed based on this new information from the Heartflow plaque analysis in over half of patients, and most of the time that change was more aggressive, better medical therapy to combat coronary disease.
So you yourself are a physician, kind of for the physicians at home, could you give us a little bit of a concept of what would maybe a clinical result be of using Heartflow's plaque analysis software?
So by way of example, in the DECIDE registry and the way the Heartflow plaque analysis fits into care is as follows. A patient will undergo a coronary CT angiogram, and the CT angiogram will be interpreted by a trained reader, and there will be, for example, here's a level of narrowing and there's coronary plaque. And what you see on this screen here is the Heartflow plaque analysis, which provides information to the physician, by the way, which can also be shown to the patient, which says not only is there coronary disease present, but also here's where it is and here's what it consists of. So for example, here one can see images of the coronary artery bringing blood to the heart muscle, and everywhere there's area of yellow and blue are different types of coronary plaque, and these amounts are then measured, and the complete volume of plaque is provided. The amount of plaque in a given artery, in this case the left anterior descending, is provided. The breakdown into calcified and non-calcified and low attenuation, which are the higher risk plaques. And finally, where the patient fits compared to their age and sex matched peers. This patient would be in the 97th percentile for their age and sex matched peers, meaning more plaque than 97% of others of the same age and sex.
Thank you so much for that demonstration on essentially what physicians see when they work with the software. Could you tell us a little bit about where you guys are at with reimbursement and how that works?
So this information has been critical with the stakeholders in the payer world as well, this information from the DECIDE registry, because from a payer's perspective, one of the most important considerations is, will physicians use a test if it's paid for? And here we've shown that what I've just shown is incredibly helpful to physicians. They will use it, they will change practice, and this has led to significant progress. Medicare is now covering this pretty much across the country. Significant progress has been made in the commercial health plan world as well, and we expect to see that accelerate over time.
Wonderful. Well, Dr. Rogers, thank you so much for your time. It's very exciting, both for patients and physicians, to see the work that Heartflow is doing. I'm Victor. This has been Cardiac Wire.
Great. Thank you, Victor.